Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to go over one easy exercise and activity that you can do to work on relieving knee stiffness and symptoms and improving your extension or straightening range of motion. So before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. Now, when it comes to having a knee replacement or having a painful, stiff knee or arthritic knee, range of motion is a big concern, a big issue, and especially straightening range of motion as well as bending, of course, too. So in this activity, what I want you to do is find somewhere where you can get your legs out straight in front of you. So you can do it in a long sitting position like this. You can do it laying down on your back, flat, whatever is comfortable and whatever you have available. And what I want you to do is first with your surgical leg or your arthritic or painful leg, quote unquote the bad leg, though we don't want to call them bad and good. So take that leg first, and I want you to push your knee down into the surface, down into the mat in this instance, and you're going to try to lift your heel up off the mat and then back down. Now we're not doing this, we're not flexing at the hip. We're really just trying to straighten the knee as much as possible and trying to actually hyperextend the knee a little bit so we can lift that heel up off the mat and then back down. Now if you're someone who has had a knee replacement or you have a lot of pain and stiffness or just arthritis in that knee, that might not be accomplishable. It might be very difficult to do that. Hopefully, even if you're unable to lift the heel up off the surface, you're at least able to feel that downward push, feel that straightening, that extension of your knee. Now what I want you to do is take the opposite leg and compare. So do that same exact thing, try to push the knee down, trying to straighten the leg, and lift that heel up off the mat or up off the surface and then back down. And what you'll probably notice for a lot of people is that the non-surgical leg or the better leg or the non-arthritic leg actually gets a little bit more lift of that heel. And what that is showing is that you're getting a little bit more extension or hyperextension of the knee joint on that side. So what can we do to work on that? Well, we can do that activity repeatedly, so for repetitions. So again, with the surgical leg or the arthritic leg, you're going to push down at the knee, trying to lift that heel up off the surface. If you can get it up off the surface, that's awesome. If you can't, just try to lift it. You're still getting that extension, that straightening. You're going to hold that for about 3 seconds, 1, 2, 3, and then let it come back down. Push in, hold it again, 1, 2, 3, and then back down. And usually I tell people maybe do 10 repetitions, 2 rounds of 10, 1 round of 15, whatever works for you. It doesn't really matter, but a good amount of repetitions of that activity, repeated motion or repeated movement we call it. And for a lot of people it can be really helpful in one, providing an acute relief of pain, acute relief of symptoms of stiffness and tightness, and also it's going to provide a benefit in terms of regaining that extension or that straightening range of motion after surgery. And as we regain that extension along with our bending and flexion, you're going to see a lot of improvements in your function, in your mobility. There's someone I do this exercise with who you see tremendous improvements in their walking. So it's really beneficial, really great exercise and activity to do. So thank you very much for watching. Again, be sure to hit that subscribe button if you haven't already. Be sure to leave your likes. I appreciate that. That helps spread this video. And of course, leave your questions below and I'll be sure to get back to you. Thank you very much for watching.